Hey, good morning. It's Dr. Tina, pelvic floor physical therapist, doula, and certified peri-steam facilitator, coming to talk to you this morning about pelvic health. Now, if you were with me for my last talk, remember we discussed the basics of pelvic health, which I call the P's and Q's of pelvic health. And if you remember, there are 9 aspects of the basics of pelvic health. Um, and if you can remember them, you might get a treat. And also 4 stages of life, especially when we talk about women's pelvic health that we're considering in those P's and Q's, right? And we discussed that all of these P's are going to affect the Q, which is the quality of life. So today I want to focus on one of those life phases that we talked about, which was puberty. All right. And remember, I said puberty includes everything from, you know, becoming, being a teenager and, going through puberty in and of itself. But what does that all entail? In the realm of women's health, we were talking about our menstrual cycle, our periods, fertility, as well as postmenopause and into perimenopause, menopause, postmenopause. All of that is included in that puberty life phase. So basically, that phase can last the entire, lifespan. So today, specifically, we want to talk about periods, okay? So you have been seeing posts that I've been putting up. August is a few things are happening in August, right? So the first thing is that I am now officially certified as a peri-steam facilitator, woo woo, through Steamy Chick, which I absolutely love, has been a dream, has been on my vision boards for many, many vision boards, and it's finally come to fruition. And I'm finally certified as a facilitator. And what that means is that I can help you create your plans for steaming in regards to your pelvic health. And one of the biggest things that steaming is amazing for, which has personally helped me in my journey of pelvic health, is with my menstrual cycle and with periods. So, cycle versus periods, we kind of use those two words interchangeably, but they're actually different. So, the menstrual cycle is the entire 1 month cycle, from the start of your period all the way through, the end of the period, through your ovulation, and to the day before the start of the next period. Your period in and of itself is that those days in which you're actually bleeding and having a flow. Okay, so there is a difference between cycle and period. And you can see I'm wearing my shirt, Feminine Flow. Um, Side note. Anyways, that just kind of worked out in and of itself. So yeah, so steaming is really, really helpful and really, really great for regulating and addressing our menstrual cycles and our periods. And there's actually a healthy standard period that we want to be working towards achieving. A lot of times folks are like, oh, we are told, first of all, we are told that our periods are normal when we have cramping and we have PMS and headaches and bloating and breast soreness and vaginal pain and nausea and vomiting. Like you go to the doctor and you tell the doctor, I'm having all these other symptoms with my period. And like, oh yeah, that's normal. And, go on about your way, pop a painkiller, use a hot pack, take a nap, drink some water, you'll be fine. Okay. Meanwhile, all those things, most of those things are great. Rest, water, resting are all great to do while your period is on, for sure. Absolutely 100%. But the band-aid of, just go ahead and take a painkiller and deal with it, or, having to take off of work or call out of work and, miss school days or miss important events, family things, whatever it is, just life in general, because you're on your period, that is not a quality of life, right? When we talked about any of these P's, of the P's and Q's of pelvic health, we're having issues with any of them, they're going to impact our quality of life. And personally, I don't think having to go through all those things is an example of quality of life. And you may or may not agree with me. That's fine. That's my opinion. So, with steaming, what it does is it just really helps to assist the body and help the body do its natural cleanse. Okay, our period is our body's way to naturally cleanse the uterus, as it was preparing throughout the month to fertilize and nurture a fertilized egg. Okay. If that didn't happen, there was no conception or anything like that, then the body is cleansing itself of all the materials that what it was getting ready and getting together to nurture and grow a baby. So our periods are important, right? And so it's cleansing that. And the steaming, all it's doing is gently helping to facilitate that process. Now, when we have all these symptoms with our periods, and even during the cycle in itself with, ovulation or spotting, things like that throughout the month, that's our body's way of telling us, hey, knock, 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 hey, there's something going on here. I need help. I'm not able to cleanse myself appropriately. Help me out here. Okay. And so while steaming is not necessarily like a douching, like it's cleansing and clearing out everything, it's just helping the body to do what it naturally is already doing. Okay. And sometimes our body needs a little bit of help. Your colon is naturally cleansing too, right? It cleanses itself of the food that you ate from early in the day or the day before, but sometimes it needs a little bit of help. We feel constipated and we need a little bit of help of passing that through as well, right? Similar thing happens in our lungs. Our lungs, every time we take a breath in and take a breath out, we're cleansing our lungs, refreshing the air. But sometimes we get a little backed up. We get mucus in our lungs when we get sick, and sometimes we need a little bit of help to clear that out. And sometimes we use steam with that as well. If you ever, got a hot bowl of water, put a towel over your head and breathing in the steam, or using a humidifier, you're using the power of steam to help your body to do what it naturally is doing to cleanse itself. That's all peristeam is doing, okay? But it's really super helpful in cleansing out the uterus and helping the uterus to cleanse itself out, and so that we can regulate your menstrual cycle and your period. All right. So there are things to know, when you are going to do a steaming, and that's why it's super important to have someone that is certified or that has experience with steaming to help you, one, to create your steam plan, select the right herbs that are appropriate for you, depending on how your period and your cycle is presenting, and getting you set up so you don't, burn yourself, injure yourself, or anything like that. And when we're talking about selecting the herbs based on how your body is presenting and what your body is telling you, probably like, well, how do I know, you know, how to do that? Well, one, the facilitator, like myself, can help you to determine which herbs and which herb blend is right for you. But there's also a way to like read your cycle and your period, right? You can actually figure out, what is my body trying to tell me? Like, what do these signs and symptoms mean? What does it mean when I have these super heavy periods, when I'm passing clots? What does it mean if my cycle is only 3 days long? Like, yay for a 3-day period, but that's actually not like the ideal period length. What does it mean when my period is like 7 days long, and it starts and it stops, or maybe I spot during ovulation week? Like, what does that all that mean? Because it all means something. Like, every symptom in our body means something. Our bodies are communicating with us, and so being able to kind of read what your period is telling you, read what your cycle is telling you, is like a lost art among us. But I can help you out with that, right? So I created a free guide so that you'll be able to consider and kind of think back, or maybe it's happening right now on your most previous cycle and period. Kind of read into, kind of evaluate what are all the things that showed up for you during that time period, and determine what that actually means for you. Because each symptom is going to point you to an imbalance that the body might be experiencing. And you may have one, you may have two, you may have three, imbalances all going on at the same time. But being able to determine which imbalance that you're currently experiencing will help you determine um, what herbs will be best for your steam plan, and how you should best be set up for your steam plan. Okay. And this will be helping you to regulate this very important aspect and kind of life phase of your pelvic health. Because for the average person, we are experiencing menstrual cycles periods for what, 40, 50 years of our life. every month for the most part, unless, you've got irregular cycles or, you got a pregnancy or so um, sprinkled into there. And so, yeah, being able to have a quality of life, that is every month so that your quality of life is not thrown off track because your period is here, right? Like, why? Why we put ourselves through that? Like, let's bring things back into balance. Let's get you back into feeling good so that you can show up for yourself, show up for your family, your friends, your work, your community, and all of that. Okay. And regulating periods isn't the only thing that steaming is great for. Steaming is actually good for birth prep, okay, for labor prep. Okay, there's special um, stipulations that come with that as well. But steaming can be great for preparing the pelvic floor for birth. It can also be great for postpartum healing and recovery. So steaming have a ton of benefits. And so really knowing what you got going on, where you are now, bring your awareness into where you are now so that you know where you want to be and know and can create a plan to get in there, right? It's like the GPS. You got to know where you're at now, put in the destination that you want to go to, and it'll give you that pathway. And so if you go ahead and if you want to comment or message me, I can send you the link to get that guide or to get onto a call with me. We can develop a steam plan together or go into the link in the bio, go onto the website. Everything is there for you to access. But I really love the free guide that I went ahead and created. It's really great and it's empowering for you to be able to like do this on your own, right? It's like we don't always have to hand our power and our abilities to take care of ourselves off to somebody else. Like my goal is to remove these barriers for you to be able to take care of yourself in regards to pelvic health, that you can start incorporating these things into self-care. Um, Hey, girl, yes, come on. Go ahead and go onto the website, get onto the link, give me a call, send me a message. You're saying even though you're 7 years postpartum, your body is still off track. Yeah, yeah. And you wish you had a doula for afterbirth. Absolutely. Doulas are magical, magical, magical services, magical beings. Love being in this space. So yeah, definitely go ahead and get you a steam plan. It doesn't matter which one you do first. You can do the steam plan, you can get the guide to read your period, you can do both at the same time. It really doesn't matter. Once you get on the call with me, we'll talk about all the things. And we'll also talk about an aspect of the P's and Q's of pelvic health so that you can start getting that aspect of your quality of life together as well and bring everything together. We're here to live our best lives, right? We only get this opportunity once. And in this time period, once in this experience, so let's make the best of it. Like we got, as women, like we are powerful magical beings and we got a lot to do, and we don't have time to be knocked off and knocked down when our periods and cycles. So let's get them together. A healthy cycle, I started talking about this, but let me go ahead and finish up with this. A healthy cycle and period should look like 28 to 29 days in between your periods, periods lasting about 4 days of consistent bright red blood. Okay, no heavy bleeding, no clots, no black or brown blood or discharge, no spotting in between, no hey, I'm gonna start, but no, I'm not really here, but and 3 days later I'm gonna start again and then go away. Like none of that, right? No pain, no headaches, no bloating, like all those PMS symptoms, all the moodiness and emotionalness, like that is not ideal. That is not a quality of life that we want to be living, and is actually not the standard and healthy period that we want to be seeing. But it is what a lot of us do experience. So let's get it together. Let's help each other out. Tell your sister, tell your friend, tell your clients, tell your mama, tell everybody that is dealing with that is still experiencing their cycles, their menstrual cycles and periods, and let's all of us get synced up. Our cycles tend to sync up when we get together, but let's all get synced up into a healthy standard menstrual cycle and period. And so I look forward to sharing more knowledge and coming on and going into deeper about each of these aspects of the P's and Q's of pelvic health with you, and meeting with you guys face to face. And remember, I've got an event coming up in September with Sati Yoga and Wellness Studio in Atlanta, Georgia, and I'll actually be talking about, guess what? Period care. So it's just gonna be a continuation of this topic and of this talk. You'll be able to tap in with it in person. Gonna be sharing more gems and a couple other different things that you can do to manage your period and to allow them to be as smooth as possible and get them regulated and get you feeling good. All right, so that event is September 9th, again at Sati Yoga and Wellness, and I hope to see all of you guys there joining us as we address period care. All right, so you'll be seeing lots of things being dropping into the post, and I look forward to chatting with you guys later. Take care. Have a beautiful and blessed day. Bye.